What if I told you that the key to fighting devastating brain diseases, like Alzheimer's and Parkinson's, wasn't some brand new, futuristic discovery, but a drug that millions of people are already taking every single day for something completely different? Today, we're going to explore a really fascinating connection that just might change how we think about protecting our brains.
So yeah, it all really boils down to this one huge question. Could a common drug for type 2 diabetes secretly be a powerhouse for our brains? I know, it sounds almost too good to be true, right? But some incredible new research is pointing in a very surprising and very hopeful direction.
Now, to really get why this is such a big deal, we have to start with a connection that, honestly, is pretty worrying, one that doctors have known about for a while now.
So here's the tough reality. If you have type 2 diabetes, your risk for developing brain conditions like Alzheimer's and Parkinson's goes up a lot. For years, scientists have been scrambling to figure out why that is. And it's right there, at that intersection, that our story really kicks off.
But what if the treatment for the first problem could also help with the second? Well, a massive new study may have just stumbled upon a critical piece of this puzzle.
And when I say massive, I really mean it. This research, coming out of Yonsei University in South Korea, looked at data from nearly 360,000 people. You know, when you have a sample size that enormous, the patterns that start to show up, well, they're pretty hard to ignore.
The researchers really zoomed in on this one specific class of drugs called SGLT2 inhibitors. Now, their main job is actually pretty clever. They help your body get rid of excess sugar by, believe it or not, literally flushing it out in your urine. Simple enough, right? But it looks like this simple action might have some really profound and totally unintended benefits.
And that, of course, leads us to the results. This is where the story gets really compelling. So let's get right into the data. Okay, let's start with the big one, dementia. The study found that patients taking these specific diabetes drugs saw their risk of developing any kind of dementia drop by an incredible 21% compared to people on other treatments. That is not a small number.
And it didn't stop there. The researchers saw a nearly identical pattern for Parkinson's disease, a 20% lower risk. This is a huge clue, because it suggests we might be looking at a much broader protective effect on the brain, not just for one specific condition.
But get this. This next number is the one that really made people sit up and take notice. For vascular dementia, that's the kind caused by poor blood flow to the brain, the risk dropped by a massive 31%, and nearly one-third reduction. That's a powerful signal that something very real is going on here.
I mean, just look at these numbers all together. It really drives the point home. You're seeing this consistent, significant drop in risk across multiple, very different brain diseases. These are not small statistical blips. These are the kinds of numbers that force you to ask a really important question.
Which is, of course, how? How on earth could a drug for diabetes be doing all of this? Well, scientists have zeroed in on two leading theories.
So what's the secret sauce here? What's the mechanism behind these powerful effects? Let's break down the two main ideas that are floating around.
Okay, so the first one is what we could call the brain fuel theory. By getting rid of sugar, these drugs kind of force the body to make more of these things called ketones for energy. And it just so happens that our brains and our nervous systems love to run on ketones. It's like a high-octane fuel for them. The other big idea is the better blood flow theory. We already know these drugs are great for your heart and your blood pressure. So a healthier cardiovascular system just means more oxygen and nutrients are getting to the brain, which helps protect it from damage over time.
And the study's own co-author, Dr. Minyoung Lee, she's a big believer in that first theory. Her thinking was, since these drugs ramp up ketone production, maybe they're just giving our neurons the exact kind of superfuel they need to stay healthy and resilient.
But other experts, like the neurologist Dr. Steve Alder, think it's probably more about that second theory. He argues that by simply improving things like blood pressure, the drugs are preventing the physical damage to the brain's blood vessels that can kickstart these diseases. Of course, it's also entirely possible that they're both right, and it's a combination of the two.
So we've got these incredible numbers and a couple of really plausible theories. But what does this all actually mean in the real world? The findings are super exciting, but it is absolutely vital to keep them in perspective.
And get this, there was another little twist in the data. The study actually found that these protective effects were even stronger in younger patients. As neurologist Dr. Daniel Trung points out, this really seems to suggest that the earlier you can step in to protect the brain's health, the better the outcome might be down the road.
Okay, so let's be crystal clear on the takeaway here. This study shows a powerful association.
It suggests these drugs could help delay the onset of these awful diseases, which would be a massive, massive win. But, and this is the big but, this was an observational study. It found a connection, a correlation. It did not prove that the drug caused the risk to go down. This is not a magic prevention pill. We're going to need a lot more research, especially randomized controlled trials, to truly confirm these findings.
But it really leaves you with a fascinating thought, doesn't it? We are always on the hunt for the next big breakthrough, the next wonder drug. But what if one of the best tools to protect our brains has been hiding in plain sight this whole time? It's definitely something to think about. Thanks so much for joining me.